Innovations in Surgical Technology, Shaping the Future of Perioperative Care. My name is Adenike, and I'm one of the moderators for today, and I'm delighted to welcome you all to this virtual event. Today, it is my pleasure to introduce our esteemed speaker for today's webinar, Dr. Eboni G. Saurage, who will be sharing her extensive knowledge and experience on the topic, Innovations in Surgical Technology, Shaping the Future of Perioperative Care. Dr. Saurage is a highly qualified and accomplished professional in the field of surgical technology, with degrees including an E.D.D, M.S., B.S.H.Sc, and A.S.S.T. She is not only a dedicated certified surgical technologist, but also a passionate educator. Currently, she holds the position of Assistant Professor of Surgical Technology at Baton Rouge Community College in Baton Rouge, Louisiana, and serves as the Director for the college's Surgical Technology and Sterile Processing programs. Recognized for her exceptional contribution, she has received the Louisiana Community and Technical College System's President Faculty Fellowship Award, highlighting her excellence as an educator. She has also earned the esteemed Fellow of the Association of Surgical Technologists designation, which recognizes her commitment to upholding the highest professional standard and improving surgical patient care. In addition to her academic and professional roles, she holds leadership positions within her profession. She serves as the Vice President of the Louisiana State Assembly of the Association of Surgical Technologists, Vice Chair of the United States Chapter of the Operating Room Global, and as a Board Director for the Accreditation Review Council on Education in Surgical Technology and Surgical Assisting. Dr. Eboni G. Saurage is a passionate advocate for advancing safe perioperative patient care through education. Her involvement in regional, state, and national committees for surgical technology and education has been instrumental in shaping the field. With her current interest in reflective practice, leadership development, interprofessional education, and simulation in healthcare, her insights are sure to be enlightening and inspiring. We are privileged to have her as our speaker for today's webinar. Please join me in welcoming Dr. Eboni G. Saurage to the Operating Room Global webinar, where our expertise will undoubtedly contribute to a thought-provoking and informative section on the future of perioperative care and innovations in surgical technology. Once again, I say you're welcome to our midst this evening.
Thank you so much. That sounds like so much.
You're welcome.
It's a little overwhelming when you hear it out loud. Again, I'm Dr. Eboni Saurage. I'm in Louisiana, and I'm very humbled that you invited me to be here. I'm going to go ahead and share my screen now so we can start on our presentation. Let's see. When I look, is my screen there, guys? Can we see? Can we see? Can we see it?
Yes, we can.
Okay, for some reason it's not showing me my Zoom screen in addition to my presentation. So if for some reason we lose it, just let me know.
Okay.
All right, so again, this is just kind of a talk about what the innovations of surgical technology are. And when I say I'm humbled, I'm very humbled because my knowledge is limited to what we're doing here in the United States. And I know in a lot of areas, they're not using allied health professionals the way we are here. And can we hear me okay as well?
Yes, we can. Yeah.
Okay, good deal. So I want to start. We did a really good presentation, introduction of who I am. So I'm not going to go over that again, but I am an educator. I've been an educator in surgical technology for, wow, I like to say 15 plus years because I don't want to claim the full 20 that I've been in surgery. But it's been a fun experience because we've watched it evolve over these years, and watching or looking forward to where it is going is exciting me. And that's really where my passion is. So just a little bit about what we're going to talk about today. The presentation is really to talk about the impact of the surgical technologists in the perioperative setting and encourage collaboration within those interprofessional teams to ensure the best possible outcomes for our patients. Okay. So we'll talk about some of the innovations that we're doing in surgery, like robotic surgery and advanced imaging, how they make the surgery safer for the patient, and how the role of the surgical technologist is really helping by incorporating them into that perioperative field. It's helping with these innovations and making it easier for the team to adopt these new technologies and make that patient, that whole procedure safer for the patient. But before we get in that, I kind of carved out some time, and I hope y'all don't mind, but it just so happened that last year at the International Museum of Surgical Science, we put on a new exhibit about surgical technology itself and how surgery's evolved over the past 50 years. And I'd really like to share that with you because it's new. If you've not had the opportunity to make it to the International Museum of Surgical Science, it's in Chicago. We've got a fun little video tour, and then we'll get into kind of the meat of what I wanted to talk about. But I want to give you the background of what the surgical technologist does, how they're prepared for the operating room, and then how they contribute from there.
We were thrilled to open the first ever museum exhibition featuring surgical technology. The operating room, surgical technology then and now, details the development and growth of the profession, the critical role of surgical technologists, and importance of an accredited education. We hope that you may all visit the International Museum of Surgical Science in Chicago to see your surgical technology exhibition and the many fascinating exhibits devoted to the surgical sciences in our collection. Thank you to all ARC-STSA educators for your work to advance the profession and for your dedication to teach and mentor future surgical technologists to provide the highest level of patient care. And now, please enjoy this virtual tour of the operating room, surgical technology, then and now.
Students from an accredited surgical technology program are educated following a nationally approved curriculum. Students are provided knowledge-based education in general education courses and surgical technology specific. Here, students are learning about medical terminology, microbiology, as well as how to effectively communicate and foster teamwork, both of which are critical in the operating room. They learn about surgical instrumentation and which instruments to use in each hands-on skills such as scrub their hands, surgical procedure. Beyond memorizing the instruments by name and function, surgical technologists must anticipate what the doctor needs and prefers for each type of procedure and how to respond in a crisis in the operating room. Of the utmost importance in the education of surgical technologists is the students' mastery of keeping the operating room sterile and patients free of infection during and after their surgical procedures. It is crucial that students graduate with the knowledge, skills, and competencies needed to become successful surgical technologists. That means being competent in all surgical specialties and as advocates for patient safety. The education of surgical technologists is extensive, and it cannot be accomplished with an abbreviated educational program or merely on-the-job training that does not follow that national curriculum. These greatly truncated formats are not sufficient to master the critical life-saving, problem-solving, and critical thinking skills that are essential in the operating room. And only students who graduate from a programmatically accredited surgical technology program are eligible to earn the National Certified Surgical Technologist credential.
ARCSTSA staff, educators, and leaders in the field work together to ensure that the programs are teaching the nationally approved curriculum and meeting or exceeding the nationally recognized accreditation standards in the field. It is our responsibility to review and approve program applications and conduct periodic in-depth program visits. We verify appropriate curriculum and faculty qualifications and resources such as equipment, instrumentation, and supplies. This is all done to ensure that the students are receiving a quality education. We also confirm that students are mastering the required competencies and participating in a minimum of 120 surgical cases in various specialties before graduating, so that they can have the necessary education and skills to provide the very best possible care to their patients as surgical technologists, because that's what it's all about. And our programs are required to seek the counsel of a program advisory committee. That's a group that's comprised of representatives from the communities most impacted by the work of a surgical technologist. They get together and discuss the development of a program, its resources, and how well the program is achieving student outcomes like retention, placement, and also earning a national credential in the field, such as the CST. Now, once accredited, programs report critical outcomes to the ARCSTSA every year to demonstrate that they're maintaining compliance with the standards and continuing to deliver a quality surgical technology program.
You know, it's funny, when I tell people that I'm studying to be a surgical technologist, they think that all we do is pick up a surgical instrument and pass it to the surgeon when they ask for it. But I've learned that I must think like a surgeon to anticipate what the surgeon will need next and have everything prepared for the surgical procedure. We are a crucial team member in the patient's safety because it's our job to be the leader ensuring the operating room stays sterile. If we are not properly educated, the patients can develop a life-impacting infection or a foreign body such as a sponge
instrument or other device can be left in a patient.
That's my plug for surgical technology education. It really gives an idea of where we are and what we're doing in the operating room. And the reason I do that is because to really understand where we're going, we have to understand where we came from. So when we look at those historical perspectives of surgical technology in the operating room, you get a chance to see how it's evolved over time. And the other thing I think I really enjoy from that museum and having the opportunity to be part of putting that together is seeing that as much as we change and grow, there's still that root and that basis that's based off of where it started. You know, a lot of our surgical instrumentation and techniques have evolved, but you'll see a lot of the same surgical instruments that they were using 100 years ago today in our operating rooms. So as we look at just look at the evolution of surgery within robotic surgery now that we're seeing, you know, what are those milestones? In the 70s, they started just exploring telesurgery. And then as we move forward, it created laparoscopic surgery, and then it kept continuing. And now we've got robots in almost every region of the country. Oh, goodness. Are y'all getting that feedback? I hope not.
Yeah.
Mute, unmute. Let's see if that'll do the trick. So as the surgical instruments evolved, so did the care of that instrumentation. So did the care of that technology evolved. In the areas that we work in here in the U.S., our nurses are trained primarily in that patient assessment role. And having to learn all of the technology on top of that adds to that training process. So with the surgical technology role, we're able to train the surgical technologists on that technical aspect of surgery and really focus that education on the front end. They're still learning the basics of patient care. They're that second set of eyes, but they're really looking at the instrumentation, the equipment, and how it can be troubleshooted and how it can be used safe for that patient. So like I said, now we're seeing robotic teams that are growing, and it's usually the surgical technologists that they're reaching out to start these robotics teams here in my areas because they've done the troubleshooting that goes along with it. So it's definitely been one of those things that's just fun to watch and fun to see grow. And it seems like every year we're getting more advanced on those surgical procedures that they're doing, even within the robotics. Now, some of the challenges that we're seeing in perioperative care, patient safety, I think, is always going to be number one, and keeping the patient safe, you know, and what can we do to make that happen? And a lot of times what I'm seeing, especially in the world of education, is we've got to get back. Getting back to our basics is important, and sharing our own knowledge is important. So as one generation, you know, grows up and starts retiring out, what are they handing off to the next generation? And I'm in that generation now. No one told me I was supposed to be in charge, yet here we are, you know, and we understand what needs to be done. How are we making sure that the ones that are coming behind us are getting that information to keep the patient safe? World Health Organization obviously is our go-to, but a lot of times it takes a while to trickle what the World Health Organization puts out as standards to the smaller communities. So how can we get that information down to them a little bit faster. And obviously, platforms such as the Operating Room Global is a perfect opportunity to do that with. Efficiency and cost is another one. A lot of the advances that we're seeing in the operating room are impacting that in one way or the other. Obviously, you know, we talk about robotics because that's just kind of I feel like the most common thing that we're seeing in the operating room. The upfront costs are more, but the patient outcomes are better. So there are investments that are being made up front so that our patients can get back on their feet and back to their lives and back to work a whole lot faster. So we have to balance that out. And you also have to balance that out within your individual institutions and communities, is if that can be afforded. And another area that I find very hard, for me at least, is incorporating those evidence-based practices. What are those best practices, and how do we identify them? Are we getting our staff to help identify them? Are they getting involved? And then how do we disseminate that information so that we can use it? It's been recognized that the lack of standardization that we use in the operating room directly affects patient outcomes, and it directly affects costs. So, you know, so how can we capture that best? How can we share what those best practices are? If there's a team that's really figured it out, how do we get that information across the country or across the globe? And then how do we get people to incorporate that? And that all comes down to, in my opinion, it all comes down to education. Another challenge we have in perioperative care setting is just the development of that synergistic team and having that team work together, having the interprofessional teams understand what everyone's role is, advance and grow. That team dynamic has to grow. And then as every new team member comes along, how are we best incorporating them to be part of the team so they can function the best? So like I said, education is my go-to. And if y'all don't mind, I'd like to ask a few questions and some feedback from you. What are the challenges you're seeing in your areas? Would anyone care to share that? I like to take in information even when I'm sharing information. Anyone? If you could just leave it in the chat or unmute.
Okay.
No one. All right. So one of the things that we're seeing. Oh, I have someone.
Yes. Yeah. Good evening, Eboni. I don't know if this applies. One of the challenges under instrumentation. I don't know if you can hear me. When your instruments, maybe like the scissors, go blunt, and it becomes difficult during surgical procedures to do your cutting. We had that challenge of not knowing what to do, not having the wherewithal to sharpen our scissors, or you are forced to start changing instruments. This is blunt, get another one, and it begins to impact on surgery time. So when instruments get blunt during surgeries.
So you're saying when the instruments aren't available for surgery?
No, when they get blunt, like scissors.
Oh, I see what you're saying. So just the maintenance, basic maintenance of the surgical instrumentation.
Yeah, I presume so. Maintenance, yeah.
Yes, yes, that's it.
So, and again, that comes back to that interdisciplinary to professional development that we really need. We need it across the board. Our sterile processing technicians play a crucial role in maintaining those instrumentations and making sure that instrumentation is ready to go on time. It's been a really fun experience this past few months. My daughter now working in that surgical role of sterile processing, so she understands it a little bit better just from growing up in my environment than a lot of people that don't. But that goes down to, again, those fundamental education opportunities. So how do we identify what are those crucial points and relate that to the team, or get that communicated to the team that we're working with? And what are the systems and processes that are working in other areas that we can maybe pick up and apply in our areas? And I think surgical instrumentation is definitely one of them. Even these new surgical procedures that are coming up. We've got some really fantastic advancements within pancreatic surgery, and using the robot to do these Whipple procedures that used to take 12 and 13 hours to do. And now I've got robotic surgeons completing them in 4 and 5 hours, but it's because he has such an efficient team that's figured out that process. So how do we get that team process to someone else? So I think dissemination of the information that we are getting is crucial as well. And we'll look into this. We moved in some innovations is what are we using to collect that information, to gather that information. And we've got some really good companies on the market. And I will, disclosure, I'm not affiliated with them. However, I have used quite a few of them. And just to get those baseline informations. And then when you come back in and you share information such as this, as the webinars that we do, or any of the local presentations that we do, we really need to make a point at getting back to those fundamental foundations that we learned when we first started, just to remind us. The injuries I've been seeing in my area have been just that. It's been patient injuries because someone forgot to put a safety strap, on the patient. So as much as we want to move forward, and I think as fast as we're moving forward, we've got to be really careful on not forgetting where those bases are for patient safety and making sure that we're still incorporating them in our own practices, but also making sure our new team members are using them in their practices too. So we look at the future. Where are we going in surgery? What's next? What are we seeing out there? And some of the stuff it's so impressive to me because I've been around long enough, so I know it can be done without it. But watching how it can make our jobs easier in the operating room is just kind of mind blowing to me. Artificial intelligence, AI, is kind of the big buzzword lately. And even though we've been using it more than we realized, there's still new applications that are being done, and seeing how they can be used safely in the surgical environment is key. So you've got a lot of people that are on the fence. They're either completely against AI or they're, opening arms, accepting it. And it's coming. It's not going to change. So we just have to figure out how to use it best. It's not going to go away. But right now we're looking at, they're using artificial intelligence in just preoperative planning, scheduling of surgeries in these larger institutions. They can program an AI system to just plug it in and fit in to the schedule based on historical averages on how long that surgery takes for that particular doctor. So we look at those predictive analytics, how long it's taken, how long it's historically taken. Another fun area that I've seen as being used is through imaging. So imaging is not entirely new. We've been used for a long time. Take their CT scans, their MRIs, but in a lot of our surgical guidance systems, they can now better create trajectories using AI. I mean, obviously, I don't want a computer doing all of it for me. I want to have some thought and some ability, but it still gives them a starting point as they're doing it. Another one that we're seeing, another area, is 3D printing. And 3D printing has been around for some time, but we're seeing it used more in surgical planning. So not only will they use it to recreate organs to do simulation training, but now they'll use patient-specific 3D printing so that they can print up, and a lot of times it's on site, they can print up a specific patient's pathology so that they can determine their best plan for surgery, and they can even run through or have their residents run through a simulated process so that the outcomes of the surgery itself is going to be more beneficial. And in some of these more complicated procedures, that's going to save operative time with the patient, so they won't be asleep as long. And it's going to save time on the team because they'll have their plan in place. And when I say team, it's not just the surgeon, it's the whole perioperative team that has a part and a role in making that surgery successful. Now, as far as education goes, I've been using quite a bit of fun things in our simulation labs, but we're using virtual reality and augmented reality to do training. There's a couple of companies that I've listed below that you're welcome to kind of dig into a little bit more. Surgical Science does a lot of our laparoscopic simulators, and they've kind of broadened out, and they're now doing interventional radiology simulators that. And it doesn't have to just be students. It could be people who are continuing that education in the field and making sure they're advancing to that expert level. But it goes through the surgical procedures. Our students learn how to navigate a laparoscopic camera. They learn surgical anatomy from that perspective of that laparoscopic view, which is very different from, a model view or a paper view. But because of that virtual reality, it puts them in that environment in a safe realm. I've also seen some of this VR and augmented reality intraoperatively, and they're still doing some research on that, but they will embed the diagnostic images into glasses. So when they look at the patient, they can see what those diagnostics are and be able to see exactly kind of where it is and where their cut should be, which is, it's kind of fun and exciting. Can we do surgery without it? Yes, but who knows how it's going to affect us in the long run as we go forward? Like, will it be able to shave 10 or 15 minutes off of that surgery? Obviously, telemedicine is a thing. It's not super new, but we're seeing more of it. We're seeing them being interconnected from one region to the next. So you may have an expert that you could reach out to consult, and they're able to see everything that's going on within that operating room or within that laparoscopic system. And then the other area I want to mention is being able to integrate this big data analytics into what we're doing. There's a company called Site Medical, and I don't know if they're completely up and off the ground, but I did review some of their work. And what they were doing is they had what they call flip guides. So it was a digital preference card for a surgeon, but it was a preference card that went intraoperatively. It wasn't just a preference card as what they needed to start. So the surgeon laid out or plotted out his surgery step by step, what instrumentation was needed, and any surgical technologist or any surgical nurse could go in and follow those steps intraoperatively. The other really neat thing was that it captured times. So it let them know exactly how long they were spending at each step of that surgery. So when you take a step back and you look at how can we get more efficient, you're able to see, did it take you too long, or does it taken you, are you faster at doing a certain step in the surgery? And it also lets you standardize those processes, because at the end of the day, patient safety is going to be improved if we can standardize the way we're doing things. But just some really fun areas that we're seeing. So just to wrap up, I know I shared some information with you, and there's tons of more information I'd like to share with you. But, we kind of looked at what that surgical technologist role is in the operating room, how they can be beneficial. It's usually our surgical technologists that are bringing these specialties into new ORs. It's usually our surgical technologists who are working in those different areas. So a lot of times they're trained, they're not team trained. They'll be trained in all the specialties. So sometimes when you're using something in GU, genitourinary, it may be applicable in another service line. Or having that opportunity to work with so many different surgeons and seeing those different techniques. But just having that extra person, in the operating room, so our surgical nurses can really focus on the patients and the assessment of the patients, is beneficial. We're continuously growing. I feel like it's hard to keep up on the education side. You're expected to know so much when you walk into that operating room, but you still have to know all those foundational basics as well. So I always tell people, when you start in the operating room, that's your starting point. That's your entry point, and you're just getting to the starting line. There's so much more that you have to learn in order to become that expert, and you just have to find what avenues it is to get you there. Obviously, I think the future of perioperative care is bright. Again, having the opportunity to share our information on larger platforms is going to get those best practices out there that we need. And I think as we move forward, we're looking more at interprofessional education so that we're working more as a team as opposed to individual silos. So if we can train as a team on the front end, then we perform better as a team on the back end. Right. And that's kind of my wrap up of what we've got. When I talk about innovations of surgery, it's so expansive, and I really didn't know which direction was best to go. So I got a really good overview. If we have any questions, I'm happy to answer them. I really like conversation and engagement. And then I do have my information on here, as well as a few resources I'll add on that we can send out after today's presentation's over.
Thank you.
The other thing I enjoy is I like to learn about you all and how things are done in other areas of the world. Like I said, I'm limited to my little bubble here in South U.S. And I'm always amazed and in awe at the way because I realize that surgery is very universal in the way we speak, even though regionally we may do things a little bit differently. When we talk about anatomy is anatomy, and surgical steps are surgical steps, and surgical sequences are surgical sequences. And I love learning how everyone does things a little bit differently in their areas. All right, so I'll open up for questions. Let's see, Jean Paul asked if we have a surgical, do we need a scrub nurse? How we work here in the U.S. is if we have a circulating scrub nurse and we have a surgical technologist, so they take the spot of the scrub nurse. And then we would have anesthesia provider and obviously our surgeons. But the surgical technologist is specifically in that scrub nurse role.
Okay.
Okay.
Thank you so much. Thank you so much for your enlightening presentations on the future of surgical technology and its impact on the perioperative care. So now that we are in the question section, while we are waiting for others to ask a question in the chat or show of hands, I would like to ask, we all know that AI is the big boss, like you said earlier, and the operating room has also jumped on the train and it's going nowhere. And with these new applications and different navigations that you have to go through, and we all also know that in the OR, patient safety and safe surgical experience is our goal. What are some of the challenges you think, or because I know you have been using AI, because currently I'm in the UK, you might have been using AI in where you work, and also you've been using it in simulations, like you said, because you're an educator. What are the challenges we might face in implementing AI in surgical procedures, and how do you think we can overcome them? Peradventure, we come across some of them. Thank you.
So one of my fears with AI is that it the critical thinking aspect. So as long as things go as planned, I think a lot of the AI can give you a baseline of your plan. But you all know, you've been in surgery, things don't always go as planned, and you've got to be able to think on your feet, and you've got to be able to make adjustments through critical thinking. So my fear as we incorporate AI is that we end up with a generation of healthcare professionals that will just rely on artificial intelligence instead of learning how to think for themselves. And I think it's just one of those areas in education that we'll have to, kind of keep an eye on. And even as we're doing professional development in the practitioner level, something that we have to keep an eye on and make sure that we're still continuing to develop those new professionals coming in.
Thank you very much for that. I don't see anyone asking. Okay, here they are saying thank you so much for the presentation. I know you can also see the charts. I have one more question. Like I said earlier, I work in the UK, and I'm also an orthopedic scrub nurse. And my next question is now in that regard, because we are seeing more and more of robotic assisted surgery these days, and they are also the orthopedic field are also leaning towards using that for patient-specific implants. And my question will now be, for the sake of patient safety also, because when you have robotic surgery, when you have to do robotic surgery and you have the machine and the computers inside the operating room, there would be a lot of people, because you will need reps also to operate these machines. And we orthopedic teams, we try to reduce the number of people in the OR just to, bring infection rate to minimum, because implant infections can be so scary. So what do you think would be the challenges and the benefits of both these procedures and AI and robotic assisted surgeries to orthopedic patients, or even spinal surgery patients in particular? Thank you.
So one of the things, what I've learned through watching those processes develop is initially it's very complicated. Initially, there's a lot of people, that have to play a part. But what our teams have done here in my area is they've simplified those processes. So they've kind of identified those key people who are those specialists in those areas, and they now kind of look at the entire room and set up the room and identify only the people that need to be there. So what used to be a really complicated, let's look at when we first started doing robots, we would have something from everything. Or ultimately, they didn't know what they needed. So as that's kind of evolved, they've really focused at the efficiency of it. And again, I contribute that to my surgical technologists, because that's what their area is. My nurse can focus on the patient care. We can focus on how can we make this more efficient. So they went from, those 4 sets of instruments and all this rep instrumentation and equipment, and they've narrowed it down to 1 set, and that's all they need. One, maybe 2 sets. With the trained surgical technologists, and we use surgical first assist, either a nurse first assist or a physician assistant or a CSFA, but they're now scrubbing into surgery to start surgery, and our students can stay at our consoles, with minimal movement back So it's really just looking at what are the integral components of what we're doing. How can we learn each other's roles as need be? And that way, if one person can learn multiple people's roles, we don't have to have so many extra people, in there. And also that efficiency. We talked about, I go back, Incisions Academy is a really fantastic business that I've kind of been working with right now, but they're doing digital pick tickets, and it's updated pick tickets so they can really define what the supply lists are, so you don't have all the additional supplies and equipment that you really don't need. But when you're starting anything new, it's a learning curve. So you kind of have to go through that, and then you find out what parts are most important, and try to push the others just to the side, or just have them, on standby in case they're needed. The other thing when you're starting something new is everyone's so excited to see it that they want to be, into it, important and involved. Our educators in our area have given our surgical teams permission to kick people out of the room nicely. Like, so, we want 5 people, no more than 5 people. If other people want to watch, they just have to watch from afar from the screen, because a lot of our ORs here are integrated with video. So you can sit in another room and watch what's going on there.
Thank you. Thank you so much. Thank you.
Welcome.
And I don't see anybody asking questions again. So thank you very much, Dr. Saurage, for your valuable insights on the role of surgical technology in the future of perioperative care and the importance of healthcare professionals itself. Unfortunately, we have run out of time for further questions. So once again, I want to say thank you so much for coming. And we hope that today's webinar has provided valuable insights into the future of surgical technology in terms of AI and robotic surgeries and the impact it has on perioperative care. Thank you so much. Thank you.
Thank you. And guys, I'm just going to, the QR code on the last screen is my LinkedIn account. I'm always happy to chat surgery with anyone if y'all have questions and want to get into more of a conversation. Because like I said, a lot of these can really just kind of stem off to conversations of their own that we talked about today.
Thank you. Yeah, we will. Thank you very much.
All right.
Thank you so
Thank
much,
you. Y'all have a fantastic.
It's been an insightful presentation.
Thank you for having me.
In fact, I would say, because you mentioned that, well, you you spoke about what's happening in the US and stuff like that. Well, it depends on the country as well. In most African countries, for example, they don't even have surgical technologists at all. They don't have them at all. I think it's just the policy. We might look for a way to incorporate something like that, maybe in terms of education, in terms of influencing protocols in hospitals, or even with the nursing board, or even medical board as well. Because in terms of staff shortages, surgical technologists can really help, since they perform the scrub nurse's role. And sometimes the confusion is actually, what is the difference between a surgical technologist and a scrub nurse? Because even on TORG platforms, the significant number of professionals, operating room professionals that we have in TORG are surgical technologists. Basically, we have thousands of them on the platform. In Pakistan, for example, they're all surgical technologists. Most of them even have PhD, like at surgical technology level. And in Iran, TORG Iran, they have thousands of professionals as well. They're all surgical technologists. They have masters in surgical technology. They have PhD in surgical, and they are not nurses at all. They scrub, they do everything. They even circulate in the OR, because that is what they are licensed to do in their own country. I think we need to bring more awareness to the role of surgical technologists, and how people can really differentiate between who is a surgical tech, who is a nurse. And even when you have both professions coexisting under the same roof, how to actually define their responsibilities, who is going to take charge of the operating room environment, who is going to scrub. I think they scrub more in the US, and the nurses, they circulate more. I think that is what they do when they coexist under the same roof. Yeah, so basically we all work as a team. The goal is patient safety. The goal is patient safety. And in terms of staffing levels, surgical technologies can really, really help. And with the way things are going, introduction of robotics, navigations and stuff, as you mentioned, I think we all need to upgrade and know what's obtainable in other fields as well, and also work as a team and collaborate with other professions in the operating room environment. So thank you so much for sharing that insightful presentation. It was an overview, and that is what we needed to start with. I know subsequent one, we might go deep into what surgical technology is all about. And specifically, some people have been sending this question: how do we become a surgical technologist? Like, if you want to travel from a low-income country or a middle-income country, you want to go to the US to become a surgical technologist, how can you actually become a surgical technologist from scratch? So I think
so that's a really good question, and it's going to depend on where and what region you land in the U.S. Some of our states have laws that require certification to practice, and in order to get certified, you have to go through an accredited program. Other states don't necessarily require that. So if you have that experience, they'll hire based on experience. So it just depends on where you land.
okay.
I guess is the best way to put it. As of now, our KHAP accreditation is looking at international programs. We haven't started looking at international equivalencies for surgical technology itself. But that's the great thing in what we do is we get to make those decisions on where we want this to go, in the next 10 years. And if that's what's needed, then, I mean, we've got the people in place that can make that happen. And I think, like you said, this platform offers that perfect, opportunity to communicate and make those things happen. That's where the magic is.
Yeah, exactly. Thank you so very much. So we might bring you back maybe in 2024, just to continue from where you stopped. Thank you so much for that insightful presentation. And to everyone, thank you for joining us, wherever it is you are watching or joining us from. Good morning, good afternoon, good night. Thank you for joining us. And in another 2 weeks, there's going to be another session as well on robotics to be